Is it possible to conceive again after having an ectopic pregnancy? By the way, what's an ectopic pregnancy? Quite often, women have gotten pregnant, they go to the hospital, and they are told that your baby is not in the womb. What is this?
Ask Dr. Othman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Othman YouTube channel, a channel where you learn medicine at the comfort of your living room. And I told you, if you'd like to get in touch with me to have a private conversation, book an appointment on my website www.drothman.com. We shall talk privately. And for those of you who don't care about the privacy, you can ask your question on all my social media timelines. Like this person asked, is called Jenny Kelly. She's saying, "Good day, doctor. Is it possible for me to conceive again after having an ectopic pregnancy? This happened to me last year and I'm worried whether I'll be able to conceive again." Now, we are going to talk about ectopic pregnancies. If it's your very first time to watch this channel, please don't forget to subscribe, press the notification bell in order to be notified of any important videos we upload. We are discussing ectopic pregnancies. Why are we discussing ectopic pregnancies? Because it affects people. It affects women, it affects men, it affects families. So it's a family issue, and therefore we must discuss it in order to look at ways of overcoming such problems. Now, what is an ectopic pregnancy? An ectopic pregnancy definitely comes from the word, when you look at the word ectopic, it means outside. So an ectopic pregnancy is that pregnancy that occurs or that is found outside the womb, outside the uterus. What do I mean? I want you to look at this very attentively. You know, last time we discussed about the reproductive system of a woman. Now let's look at this. So when you look at this, this is the cervix, this is the womb, or call it the uterus. This one. These are the fallopian tubes, and this is the ovary. I told you, remember in my conversations, I said that during ovulation, that is the time when a woman is ready to conceive, the egg or the ovum will move from the ovary into the fallopian tube, and it will stop at a place which is called ampulla. At this ampulla, the egg will stay there for at least 24 hours. Now, when you meet a man, the man is going to release sperms here at the V. And these sperms are going to swim towards the egg. So it means the sperms are going to find the egg in the fallopian tube at a place called ampulla. At a place called ampulla. Now what is going to happen is that fertilization is going to occur. There's going to be fertilization. When fertilization occurs, a zygote is going to be formed. That is the fetus. Now, after formation of the zygote or after formation of the fetus, this zygote or the fetus is supposed to move. It is supposed to move. It is supposed to be propelled, and it comes back to the uterus. So when it comes to the uterus, it has to settle in the uterus here. This is where the baby is supposed to be. Now, once the baby is here, the baby will grow until delivery. So when the baby is here, we call that an intrauterine pregnancy. So there are circumstances when this baby doesn't come here to the uterus. So once the baby is outside the womb, we shall term that as an ectopic pregnancy. So which sites can this pregnancy go? Can this baby go? The baby may fail to move. Like after fertilization, actually the commonest ectopic pregnancy, the commonest site for the ectopic pregnancies is the fallopian tube at this level. Either at the ampulla, but within the fallopian tube here. Why? Because during fertilization will occur. When fertilization has occurred, the egg will not move to this place. The egg will remain in this side. Will remain in the tube, and we shall call this a tubal pregnancy. And the tubal pregnancies are ectopic pregnancies. Actually, it's the commonest form of ectopic pregnancy. Therefore, when the fetus, when the embryo, when the zygote does not move, is not propelled back into the uterus, we shall have a tubal pregnancy, what we call the ectopic pregnancy. Other sites where ectopic pregnancy can occur is the ovary. Is the ovary. Actually, there are two ways in which you can have the fetus or the baby growing into the ovary. Now, number one is when this egg matures. The egg matures, it tries to move, but it doesn't cross. It remains in the ovary, just here at the entry, at that weakest point of the ovary. Now, when it remains there, of course, it's fertile, and it has that smell, that it's called a scent, a scent which is attractive to the sperm. Now, this sperm is also going to move because of this scent that is so attractive, so appealing. Please come, please come. You know, like how the ladies can seduce you. You can persuade someone to come to you. So, you know, using that language, that is what is going to happen with the ova or with the egg. Now, it is going to persuade the sperm. So the sperm may find its way into the ovary, and fertilization is going to occur. When fertilization occurs from here, kaboom, you'll have an ovarian pregnancy. Another way is when fertilization, normal process occurred, the egg moved to the fallopian tube at the ampulla region, the sperm found it here, fertilization occurred, a zygote is formed. Instead of a zygote going this direction, it goes backwards, and then it goes into the ovary. So that will be an ovarian pregnancy. There are several other sites where ectopic pregnancies occur. Actually, we've seen ectopic pregnancies occurring at the cervix, at the level of the cervix. What happens? Fertilization occurs, but then the zygote moves, it doesn't stop in the uterus, it passes through, and it implants itself in the cervical canal. And that is also an ectopic pregnancy. We've seen also areas where the fetus implants itself now outside even the whole of this place, and it implants itself at the region where there is the liver. Recently, in Uganda and Soroti, they separated, they delivered the baby from the liver. This baby grew up from the liver, from the lobes of the liver. And then during delivery, surgery was performed, and the baby was gotten out. So we can have a liver pregnancy, whereby the fetus, the zygote, is pushed into the liver, and it grows from there. We've also seen cases where the fetus instead is brought into the abdominal wall, into the peritoneum, inside there, the abdomen, and the fetus grows from there. You find the fetus on the gut. So all those are ectopic pregnancies. But I've told you the commonest is the tubal pregnancy, or what we call the ampulla pregnancy. It's the commonest. Now, we have to look at the signs. How will you know? Because yes, we've seen all this. How will you know that probably I am carrying an ectopic pregnancy? You yourself, even before you go to the hospital. These are the signs. Number one, there will be, actually, these ectopic pregnancies, especially the tubal pregnancies, are detected early, before even 3 months. First month, second month, third month, fourth month, it's late. But they can be detected from there, especially the tubal ones. Now, what happens is that you'll have severe lower abdominal pain. A woman with an ectopic pregnancy, especially the tubal pregnancy, will experience severe lower abdominal pain after conception. And this will be followed by light bleeding, or even no bleeding. But usually there is light bleeding. Now, someone will tell me, oh, but this can also be a sign of a miscarriage, or losing a baby, abortion, and so on. Yes, even in miscarriages or in abortions, we shall have lower abdominal pain and PV bleeding. But With abortion or with a miscarriage, usually in most cases, it's the bleeding that comes first before the abdominal pain. But for the ectopic pregnancies, it's the abdominal pain, the lower abdominal pain, the pelvic pain that comes first before the bleeding. And the bleeding is light. Someone is having light bleeding with severe abdominal pain. That should ring into your mind, and you have to report to the hospital to confirm whether your baby is in the right position. Then another one is dizziness. Actually, this, to some people, this can be the only sign. It can be the only sign. Actually, some women just collapse. They faint. All of it, he's been doing something, all of a sudden starts vomiting and then faint. Brought to the hospital. And at times, by the way, some women faint when they have not even yet discovered that they are pregnant. They don't know. They just bring a woman in the casualty, has fainted. You do some tests, urine tests, is pregnant. Ultrasound scan, ectopic pregnancy. So dizziness or fainting or sudden collapse may be the only sign of ectopic pregnancy in some individuals, but usually severe abdominal pain, light bleeding. Then at times a woman can have pain in the shoulders. If you have that unusual pain in the shoulders, it can also indicate that probably you have an ectopic pregnancy. Now, once you see those signs, please run to the hospital and confirm. And how is the confirmation going to be done in the hospital? Ultrasound scan. We are going to use an ultrasound. It's the simplest. Of course, there are several other scans, but the easiest and simplest is an ultrasound scan. What is it going to detect? Of course, it is going to look into the uterus. First of all, you run a pregnancy test. Confirm that you're pregnant. Now, after confirming that you're pregnant, do an ultrasound scan. Checking the uterus, there is nothing. The uterus is empty. Check around, tubes. The fetus is there. If it is not in the tubes, check around, cervix, the ovaries, everywhere. You'll be able to detect an ectopic pregnancy. Now, what causes this ectopic pregnancy? What causes it? Most people, the highest percentage of people, of women who get ectopic pregnancies have suffered from PIDs, or they have PIDs. Pelvic inflammatory diseases. I discussed about these diseases in one of my previous videos. Pelvic inflammatory diseases, you can visit them. You can visit that video and find out all about PIDs, or pelvic inflammatory diseases, all those infections and so on. I discussed them. Check my other videos. Now, PIDs, especially the gonorrhea and chlamydia of this world, these infections, those PIDs, they will have to, number one, they can either, when if you have them, if there is a current infection, the current PID, or even after healing or getting treatment, and you get cured or healed from PIDs, they can heal with scar formation. Now, the PID, remember, these PIDs are affecting the fallopian tubes. So because they are affecting the fallopian tubes, you may get medicines and you heal, you get fine. However, in the healing process, they leave a scar around here. So when they leave a scar, after fertilization has occurred, this fetus is supposed to be propelled to move to this side, but it will be resisted. It will face resistance from the scars. The egg cannot be propelled. It cannot be pushed properly through the fallopian tube to the uterus, and thus it will remain there. It will get blocked from there, and you'll have a tubal pregnancy. So that's how PIDs are able to cause tubal pregnancies and other ectopic pregnancies. Another cause is multiple abortions. My sisters, having several abortions is a very big risk factor. Actually, it's one of the main causes of ectopic pregnancies. So that's why I usually tell people, use family planning. Go for family planning. Go for contraception. Instead of going there without contraception, you get pregnant, you're not ready, and you go for an abortion. Yes, there are times when it is inevitable, but try to avoid abortion. So, abortions, multiple abortions, can lead to ectopic pregnancies. Why? Because those abortions can lead to formation of scars. They can lead to formation of scars in the tubes, scars in the uterus, and you'll end up having an ectopic pregnancy. Another factor is the abdominal or pelvic surgeries. So now, if someone gets an abdominal, gets an abdominal surgery or a pelvic surgery, probably they are doing some surgery, operation in the tubes or in the uterus, or an operation of the appendix and so on. Those operations leave scars, they leave adhesions. What we call adhesions, they are like threads. There can be threads here in the tubes, threads everywhere. And now when there are threads around here, of course they will obstruct the movement, the proper transportation of this zygote from the tubes back into the uterus. So you'll end up having an ectopic pregnancy. Endometriosis. I told you in one of my videos about endometriosis. I told you that endometriosis is the condition whereby there is implantation of the underlining of the uterus, that is the endometrium, outside the uterus. I don't know if you're understanding. You see, we have this part called endometrium. This part, this smooth membrane, it's called endometrium. It is the innermost layer. It is the innermost layer of the uterus. Now you find there are some conditions, like I discussed, check in one of my videos about endometriosis. There are some conditions whereby this lining, which is supposed to be only in this place, is implanted or is somewhere here, it is somewhere here in the ovaries, it is somewhere here. So once that happens, you may end up having an ectopic pregnancy. Smoking. Women who smoke, I have seen recently, my sisters are doing shisha, a lot of shisha, a lot of smoking, a lot of chewing, those smokes and so on. There are many things, many activities related to smoking. Smoking has been associated with ectopic pregnancies. And now, also, family planning. I talk about family planning. There are very many good things about family planning, but there are times when the family planning may go wrong. For example, you had a bilateral tubal ligation. This is one of the best methods of family planning I really like, where a woman no longer wants to conceive again. A woman has had children enough for her and she doesn't want to conceive again. She does a bilateral tubal ligation. Now, if this tubal ligation is not done properly, we call that failed bilateral tubal ligation. Someone, they cut the tubes, but they conceive again. So those people that conceive after a failed bilateral tubal ligation are at a great risk of developing an ectopic pregnancy. Because remember, during bilateral tubal ligation, I'll teach about this in one of my next videos. We come to these tubes. It's an operation that comes to the tubes. When we reach the tubes, we cut these tubes. We first tie and then cut them. So when we cut them, we separate, we discontinue, or we create a miscommunication between the ovary and the uterus, and the woman will not be able to conceive. So once this happens and it fails, then it will lead to formation of 1, scars, 2, adhesions, and 3. When the union happens again and the egg manages to pass through and it comes to this side, or it comes to this side, the place will be rough, and all at times the space is very narrow. The sperm can pass, the egg can pass, but both of them, once they form a zygote, the space is very small for them to pass and come to the uterus, thus having an ectopic. Then the last cause of ectopic pregnancy is also a failed IUD. Now I told you about the IUD. The IUD is put here. This is how the IUD is located, here into the tubes for fertilization to take place. Now, if this IUD is displaced in any way, and someone manages to conceive, then there are chances that this person is going to have a tubal pregnancy, because maybe it is displaced and there is a small gap here where the sperms have passed. They will pass form a zygote, but the zygote may not be able to pass through the same path. Though most women after failed BTL, after failed IUD, they will still, the babies will still be in the uterus, and then you deliver very well with an IUD in situ. And also, women who have ever had ectopic pregnancies, that is what we call previous ectopic pregnancies. If actually science says, studies show that if you've ever had an ectopic pregnancy, then there are chances that even the next pregnancies may be ectopic. However, now that again depends on how you managed the ectopic management of an ectopic pregnancy. So what do we do? You've confirmed the baby is not in the uterus, it is outside the womb. What are you going to do? Number one, an ectopic pregnancy is taken as an emergency. It's a medical emergency. It's a gynecological emergency, or what we call an obstetric emergency. So now, because it's an emergency, we have to rush and make decisions very fast. Now, again, the decisions we are going to take will depend on the following factors. Where is the pregnancy? If the pregnancy is in the tubes, let me first start with other areas. If the pregnancy is in the abdomen, we weigh the risks. At times we can leave the baby there. We can leave the baby there, but we continue monitoring, especially when it is not on any sensitive area. It is just in the peritoneum, there on the gut, on the intestine. We can leave the pregnancy to grow. Now, if it's around the liver, like we've seen that case of a Ugandan woman who had a pregnancy in the liver and was operated here in Uganda, in Tororo. Now, in Soroti. Now, if the pregnancy is there, you may leave it and monitor the woman. She can deliver very well, very well. If the pregnancy is in the ovary, that end, we may also leave the pregnancy, but with great caution. However, when the pregnancy is in the fallopian tubes, there is no shortcut. That pregnancy has to be terminated. That pregnancy has to be removed. And there are now two ways. There is the medical method and the surgical method. Now, this, whether medical or surgical, it should be a detailed conversation between you and your doctor. Don't say that Dr. Uthman said on his YouTube channel that when you have a tubal pregnancy, do surgery or go for medical. No. Just know that those options exist. Discuss them with your doctor. You will have the final say. Both of you will have the final say. Now, there is the medical method, whereby we give you an anti-cancer drug. There are anti-cancer drugs called methotrexate. Methotrexate. That drug can be used to cause, actually it dissolves, it shrinks the zygote, and then the zygote dissolves within the body, and you get rid of this ectopic without surgery. Without surgery, this ectopic, this fetus, can be dissolved within the body and reabsorbed by the body actually. So it's possible. There are medicines that can do that. However, if it is ruptured, because there are cases where this ectopic, this fetus is here, it is still intact. But when it ruptures and it starts bleeding, that is an emergency that requires surgery. Therefore, we are going to do laparotomy. We are going to open your abdomen and remove it. Or in areas where you can afford laparoscopy, they will do laparoscopy and remove the fetus. That's how it's managed. Of course, there may be conditions where you need blood, you need pain medications, you need antibiotics, and so on. Those ones come depending on the clinical assessment, on your clinical assessment by a professional doctor. Now, the question was, doctor, is it possible for me to conceive after an ectopic pregnancy? There are many conditions. There are very many factors. But my answer will be yes, you can conceive. Several women have conceived after an ectopic pregnancy. Take take an example. If the ectopic pregnancy was in the liver, very easy to conceive. Let's go to the one that is more complicated. That is the tubal pregnancy. You have 2 fallopian tubes. You only need one to conceive. If it's this one that has had an ectopic pregnancy, then the next pregnancy you may consider this. Again, it also depends on what was done. What did you do? We used medicines. We used medicines to dissolve the fetus, the zygote. You will conceive again. Except if the reason as to why you had an ectopic is still there. You had adhesions are still there, and they are in both tubes. You will again have an ectopic or so. But if the reason is no longer exists, for example, you had a PID active, you treated it, everything is now fine, you will conceive again. 2, if they do surgery, the chances of that tube they have done surgery on lower. The chance is lower. However, now again, those depend on, because you can go in and just remove the zygote and then leave the tube intact, properly intact. That person can conceive with that tube again. But at times you go there and you can't preserve the tube. You go there when the tube is already destroyed, the fetus is all attached on the tube, and you have to cut the tube out. So this tube will be closed. But still, once this is closed, the left tube, then the right tube can still conceive. So you can still conceive. Unless you're saying when the person went there, this tube was destroyed and this one was destroyed and the person cut both tubes. That's when you cannot conceive. But you can conceive depending on those conditions I have told you. So it shouldn't be a worry for anyone had an ectopic pregnancy and thinks may not conceive again. If it's your very first time to watch this video, to watch this channel, please don't forget to subscribe. Press the notification bell in order to be notified of any important video we upload. And I told you, if you have a question, go to our timelines on all our social media platforms and ask that question. Remember, that question is public, anyone can see it. If you want a private one, you want to chat with me directly, privately, go to my website, www.drothman.com, and book an appointment. We shall be there to discuss.
Ask Dr. Othman on Sawa Wall.